Let's face it, no one wants to go to the emergency room, whether it's for your child or for yourself. But things happen, and if a medical emergency does arise, luckily we have the Kaweah Delta Emergency Department right here in our own backyard. Kaweah Delta's emergency department sees around 90,000 patients each year, and they're always here ready and waiting to help improve your family's health. Our Stephanie Bainham took a trip to Visalia to learn more.
The emergency department at Kaweah Delta is one of the busiest in California, as it's the only trauma center between Fresno and Bakersfield. And here to explain more and tell us all about it, we have Dr. Kona Singh. He's the Chief of Emergency Medicine at Kaweah Delta. And we're also joined by Dan Allain. He is the Assistant Chief Nursing Officer here at Kaweah Delta. Gentlemen, thanks for being with me today.
Our pleasure.
Our pleasure. Thank you.
So, Doctor, tell us about the emergency department here at Kaweah Delta. What's it like on a regular basis?
We're a pretty busy department. We see an annual volume of approximately 90,000 visits per year. We're a designated level 3 trauma center, as well as a STEMI center and primary stroke center.
And so, Dan, when should people know when they need to get to the emergency department?
Well, the emergency department really should be used when you have a life-threatening condition, such as a heart attack, a stroke. If you're diabetic and you're getting weak, dizzy, you could be having low blood sugars. Those would be some examples of when to seek an emergency department.
So, doctor, are there some times where there might be another place to go that would better serve a patient than the emergency department?
Yeah, absolutely. There are multiple access points throughout our healthcare system. I would say for stable management of chronic diseases, that would be best served by a patient's primary care physician. For those urgent complaints such as ankle sprains, coughs, and colds, those can be well treated at our urgent care centers. And for those emergent complaints, strokes, heart attacks, traumatic incidents, that's what emergency departments are best designed for.
And Dan, the emergency department is always willing and ready, right? Because hospitals, you guys have to see everyone who comes into the emergency department.
That's correct. It's EMTALA. There's a federal law that basically mandates anybody that presents to the emergency department, we're required to evaluate the patient. We refer to it as a medical screening exam. And once we determine the stability of the patient, then we can look at moving them to another level of acuity treatment area.
And so what should folks know about the level of care that they're going to receive here at the ED at Kaweah Delta?
Well, the emergency department's the safety net for our community. So we will see, as Dan mentioned, secondary to EMTALA, any and all visits that come through our doors. We're the public safety net. That being said, we have a triage process, so when patients first arrive at the emergency department, they will be quickly evaluated by one of our nursing staff and appropriately triaged. So the sickest and most critical patients will often get seen first, but our goal is to treat everybody in an expedient manner.
And when patients do come to the ED, they should have a medication list with them. What is that?
Well, a medication list is a list of meds that they take that's prescribed by their primary care physicians. And there's multiple ways of doing that. Some people keep a list that's written down in their wallet or their purse. This day and age, some people have just a simple picture of their phone, and that's often very helpful for the emergency department because it will help transition that care from the outpatient setting into the ER and then back again.
That's good to know so that the ED can be as quick as possible because, Dan, everyone always associates wait times with emergency departments. Isn't that right?
That's correct. One of the first questions after they present to our start nurse is, do you know how long it'll take? And the unfortunate reality of an emergency department is we could tell you it may be 30 minutes and then 3 or 4 ambulances come through on the back entrance, which they don't see, which then shifts the acuity of the patients. So I would say on average, we like to have a patient seen by one of our physicians in the front within about 20 to 25 minutes. And then from that point forward, they may be moved into lower acuity areas. They may be taken directly back to the emergency department in one of the critical care areas, depending on their acuity of injury and illness.
Yes, it's very important. Like you said, doctor, the ED is the safety net for the community. So be patient, and if they have any questions about wait times or anything else, who should they contact?
I would say there is a charge nurse that's always available in the department, and actually we'll have 2 24 hours a day probably after July 1st, but ask for the charge nurse, and they would be the ones who could best give them a time frame.
Wonderful.
Okay.
Well, I know you guys are working hard every day, and thank you for talking with us today and helping educate our community about the emergency department here at Kaweah Delta. We appreciate your time.
Sure.
Thank you.
Thanks, Stephanie.
Thank you.